Hi friends, welcome to the Safe Path Veterinary Services. In our video series regarding the diseases of the dogs, this is our second video. In this video, we will talk about another infectious disease of the dog, that is canine parvovirus infection. If we talk about its manifestation in the dog, it is manifested in two forms. First is the myocarditis form, and next is the enteritis form. Next, we will talk about its etiology, its transmission, its pathology, and its clinical sign and treatment. The canine parvovirus infection is a highly contagious viral illness that affects the dog. This virus is manifested in two forms: the intestinal form, which is characterized by the vomiting, diarrhea, weight loss, and lack of appetite, and a cardiac form, which attacks the heart muscles of the young puppies and often leading to the death. That is manifested in the form of the cardiogenic shock or in the form of the pulmonary edema and the dyspnea. If we talk about the incidences and distribution, the canine parvovirus was first recognized in 1978. The virus is more than 98% identical in DNA sequence to the virus of the feline panleukopenia virus. The majority of the cases are seen in puppies that are between 6 weeks and 6 months old. Because this virus replicates in the rapidly dividing cells by the mitotic. That's why the young puppies that have the higher rate of the mitosis that are at high risk of the canine parvovirus. The virus present worldwide today in different form and original from the original virus. There are some dog breeds that are more susceptible than the others without any known reason. These include the Rottweiler, Doberman Pinscher, Pit Bull, Labrador Retriever, German Shepherd, English Springer Spaniels, and the Alaskan Sled Dogs. These are particularly vulnerable, but these their vulnerability and susceptibility have been experienced, but their real reason is not known that why they are more susceptible to the canine parvovirus. If we talk about the etiology, this is caused by the DNA virus canine parvovirus, that is known to be the smallest virus, and that is non-enveloped and lack essential lipid. Non-enveloped means that is not coated with any host cell membrane. That is icosahedral in shape. There are two types of the canine parvovirus that are common in the world, that is canine parvovirus 1 and canine parvovirus 2. In 1970s, yeah, or in the early times, that the canine parvovirus 1 was most common, but nowadays the canine parvovirus 2 strain is the dominant strain. Most cases of the canine parvovirus infection are caused by a genetic alteration of the original canine parvovirus, the canine parvovirus type 2. If we talk about its transmission, the parvovirus is spread either by direct contact from dog to dog or indirectly by the fecal oral route. Heavy concentration of the virus are found in an infected dog stool. It means the virus is secreted with the excreta of the infected dog or the puppy. So when a healthy dog sniff an infected dog stool or licks it, it contracts the disease. Viral excretion occur from the day 2nd to the day 8th following the infection. This diagram represents the infection contracted by a dog from another dog. Here you can see a carrier dog excretes parvovirus in feces, and other dog ingests the parvovirus. The parvovirus multiplied in intestine, and the dog become parvovirus carrier. And this cycle continues if the dog becomes ill or the sick. It is taken to the veterinarian or hospital. After the successful treatment, it recovers, or if this treatment is not successful, then unfortunately it will die. If we talk about the pathogenesis, ingestion of the minimal amount of the infectious parvovirus, the parvovirus is ingested. The virus replicates in the oropharynx, spread via bloodstream to the lymph node, bone marrow, intestine, and cardiac muscle. The viremia take place, that is manifested in the intestinal disease, but rarely in the cardiac sign. Death may occur due to the shock from the dehydration or the septic shock or cardiogenic shock or heart failure. If we talk about the clinical syndromes, mean the clinical conditions, the combination of clinical conditions that determine whether the animal is going to be infected or the animal is not going to be infected. These include three conditions: the host vitality, environment, and the virulence of the virus. If we see at the host vitality, that is the immune experience and the vaccination status of the animal. The environment include the humidity, temperature, condition of environment, whether it is favorable for the long-term survival of the virus, or whether it is favorable for or stressful for the animal, that it will suppress the immune system and will the animal will get infected with the virus. And third is the virulence of the virus, that include the viral load, that how much viral virus the is present within the animal. If we talk about the protection of the animal from the virus, that is first of all, that is the colostrum. The maternal derived antibodies from the colostrum of an animal that will prevent the disease up to the 2 month age of a puppy. After that, there is a regular vaccination schedule, and you can keep your puppies indoor until the vaccination series are completed. The clinical signs include in the intestinal form that are the severe bloody and foul-smelling diarrhea, lethargy, anorexia, severe weight loss as a result of the diarrhea and weight loss, and hypothermia rather than the fever. The wet tissue of the mouth and eyes may become noticeably red, and the heart may be beat too rapidly. The vomiting, especially the vomiting, have a frothy yellow color, and there is a life-threatening dehydration in the animal as a result of the vomiting and the diarrhea together. And there is initially there is a brownish semi-solid feces of the animal that are followed by the bloody diarrhea. There is the animal faces polydipsia, retching, restlessness, and the peripheral circulatory failure due to the heavy dehydration. In the case of hemorrhagic enteritis, we can see the villi become blunted and unable to absorb nutrients. Barrier of the GIT flora is broken down. And here you can see in this picture the normal villi and the broken disrupted villi. In the biopsy of the small intestine, you can see the collapsed crypt and the depleted pear patches in these pictures. Here you can see the inclusion bodies in the crypt cells. In the cardiac form, that is confined to the puppies of the 2 to 8 weeks of the age, or you can say less than 10 weeks. Symptoms may or may not exist. Death may be sudden or follow a brief period of dyspnea, and the pulmonary edema may occur. That the death occur actually due to the cardiogenic shock. Means the heart is not able to pump the sufficient blood that is required by the body. If we talk about the clinical diagnosis, that is at the clinic, that is based mainly on the you can say clinical signs that include the bloody diarrhea and the foul smelling bloody diarrhea, and also the yellow colored feces, and you can say red color of the eyes and the conjunctiva and the mucosa. These are some conditions that will you can say refer toward the canine parvovirus. Other include the animal inoculation test, serum neutralizing test, isolation of virus, and the hemagglutination, inhibition, FAT and ELISA, abdominal radiograph, ECG change, commercial diagnostic kits, rapid parvo antigen kit test, CPV detection. Canine parvovirus detection is used for the canine parvovirus detection, that is rapid parvo antigen test. If we talk about the post-mortem finding, in the enteric form, the following signs are seen. The lower and the middle small intestine is dilated, content are watery and flocculent, you can see in the form of a suspension. Bone marrow is depleted. In the myocardial form, the lungs are heavy and edematous, grey pink in color with focal congestions. Heart is dilated will ill-defined pale areas in the myocardium, maybe hemorrhagic in the pancreas. Clear watery fluid in the thorax and abdomen, pale flabby heart with myocardial fibrosis is in more common cases. Treatment include the heterologous immunoglobulin, I mean the serum treatment that is given to the animal, that is helpful in the you can say uh, ready recovery. You can say that it causes the recovery of the animal in a few time, and there is no specific treatment for the parvovirus. We can use the symptomatic treatment that includes the steroid, broad spectrum antibiotics, and the fluid and electrolyte therapy. That is most important because of the severe dehydration in the case of parvovirus. Whole blood transfusion is warranted against severe blood loss, anemia. For persistent vomiting drug, we can use the antiemetic drug, that is the metoclopramide with the 0.5 mg per kg body weight at 8 hours interval to prevent the diarrhea. loperamide or bismuth subnitrate or other astringent preparations that gives the covering to the mucosa of the intestine to prevent the blood loss and to prevent the you can say contraction of the intestinal microflora with the body. Here we can see some antibiotics, metclopramide, that's a bactericidal. You can say ampicillin, that is also bactericidal. These are used to support the secondary bacterial infection rather than specific toward the virus. The secondary bacterial infection that are going to infect the disrupted mucosa of the intestine that are infecting the animal due to the compromised animal that due to panleukopenia, and cefazolin, that is first generation cephalosporin, and rofloxacin, that is a fluoroquinolone, and that inhibits the DNA of the bacteria. Antiemetics, that is metclopramide and chlorpromazine, that blocks the chemoreceptor trigger zone centrally from the brain, and ondansetron, that is 5-HT3 receptor antagonist, that used as the protective agent for the intestine. If we talk about the prognosis, most recover with intensive therapy. Doberman and Rottweiler are the sensitive to the virus. Poor prognosis in the case of interception, hypoproteinemia, and no improvement after the fourth day of intensive care. If there is no improvement, if we are taking the animal in the intensive care, then there is a poor prognosis. The home care include the antibiotics therapy should be continued, diet management should be used, bland, highly digestible food should be used, frequent and small feedings and at various intervals should be used, and restricted activity, avoid introducing new puppies and disinfect with the bleach. If we use new puppies, if we induce new puppies, they will contract the disease, or if there is no previous disease, then these puppies will may get the disease to the new animals. If we talk about the control and prevention, the strict hygienic measures are to be adopted. Segregate infected animal from the healthy one, and treat excreta should be properly disposed, and the premises should be disinfected. If we talk about the vaccination, the puppy less than 3 months, you can say either get 2 injections or 3 injections. You can be, because at the age of till the age of 2 months there is the maternal derived antibodies that you can say limit the production of the antibodies due to the vaccination. That is why the early vaccination may be failed due to the limited antibody production. And the first injection is given between 6 to 8 weeks, second injection at 10 to 12 weeks, and third injection at 16 weeks. The third injection is the most important because at the 16 week the maternal derived antibodies are more probably they are not present. There is the full immunity capability of the third shot of the vaccine. In the dogs that are more than 3 month age, only one injection is used. So this is all about the canine parvovirus infection in the dog. Thank you very much.